Everybody smiles when they go to the doctor.
Hi, my name is Talia Rentrope. I'm a student nurse at LSUA. I'll be performing a physical assessment on you today. Is that okay?
Okay.
Alright. Perform hand hygiene. Okay, can I verify your name and your date of birth?
Francis Rentrope, 4157.
Okay. Are you allergic to any medications, any food, any latex?
Allergic to sulfur. Tramadol. I think that's the only two.
Okay. Do you know where you are today?
Yes. I'm in my home.
Okay. Do you know why you're here?
Yes, for assessment.
Okay. And do you know what the current president is?
Yes, Trump.
Okay. Patient is awake, alert, and oriented times 3. Okay. Patient is calm and cooperative. Patient appears clean and well groomed. Patient's weight appears normal for height and body build. Okay. I'm going to put on my gloves now. Are you in any pain today?
No, ma'am.
Okay. If I would assess old CARTS, which stands for onset, location, duration, characteristics, aggravating factors, relieving factors, timing, and severity. Okay, I'm going to start inspection and palpation of your head. If you experience any pain, just let me know and I'll stop.
Okay.
Okay? Alright, we have no lesions, no bumps, no bruises, no nicks, no infestations. Patient appears well groomed. Ears are non-palpable. No pain.
No.
Okay. Ears are symmetric bilaterally. I'm just going to take a look inside and make sure there's no drainage. Alright, no drainage noted. Okay, now I'm going to perform a whisper hearing test. I want you to cover, I'm going to go behind you, I want you to cover one ear. I want you to repeat what you hear. Okay?
Okay. I think I heard green.
Okay. Do the same with the other ear.
I think I heard red.
Okay. Patient's hearing is intact bilaterally. Okay. Now we'll move on to your face. Patient's eyebrows are symmetric bilaterally. Hair is evenly distributed. Patient's eyelashes curl outward bilaterally. Conjunctiva is moist and pink. Sclera is white. Cornea is clear and smooth. Iris is brown in color. Pupils are a size 4 millimeters in size bilaterally. There is no drainage coming from the lacrimal duct. Now I'm going to palpate your sinuses. Let me know if you feel any pain.
Okay.
Okay. Patient sinuses are non-tender. Okay. Now I'm going to move on to your mouth.
Okay.
Patient's lips are pink and moist and supple. I want you to open your mouth for me, please. Patient's teeth have no discoloration. Can you say ah for me? Okay. Uvula is midline. Soft rise and fall of the palate. Mucous membranes are intact. You can close your mouth for me. Okay, next I'm going to palpate your lymph nodes. Let me know if you feel any pain.
Okay.
Lymph nodes are non-palpable. Now I'm going to palpate your carotid artery, and I will not do both of them at the same time due to if you palpate both carotid arteries at the same time, the patient will faint.
Oh.
Okay, patient's carotid pulse is a +2 regular bilaterally. Now I'm going to move on to your arms. Patient's skin is warm, dry to the touch, intact. There's no swelling. There's no nicks, no bruises, no lesions. Now I'm going to palpate your radial pulse. Okay, radial pulse is actually a +3 bilaterally, regular. I caught myself. Now I'm going back to the eyes. I forgot to do the eye test. I'm going to do a series of eye tests. Going to check. First one is the cardinal field gaze. I'll just follow the tip of my pen with your eye only. Okay, there is no extraocular movement noted. Now I'm going to be testing for accommodation convergence and the pupil's reaction to light. The first thing I want you to do is look at the tip of my pen, look at the mirror, look at the tip of my pen, look at the mirror. Okay. Next I want you to follow the tip of my pen with your eyes only. Okay. And next I'm going to shine a light in your eye. Okay. Pupils are equally round and reactive to light with accommodation and convergence bilaterally equally. Okay. Now I'm going to move on to your lungs. I'm going to listen to your lung sounds. And I want you to breathe with your mouth open.
Okay.
If you're feeling any lightheadedness, just let me know and I'll stop. Breathe. Your mouth open. Breathe. 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 Okay. Now can I get you to stand up for me? Turn around. There's a yelling sound in the back. Okay. You should do the same thing. Breathe through your mouth. Breathe. 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 And breathe. Okay. Patient's lung sounds are clear. Alright, you can sit on the bed. Okay. Now I'm going to listen to the patient's heart sounds. First one is going to be the aortic valve, which is on the right sternal border, second intercostal space. Next is going to be the pulmonic, which is on the left sternal border, second intercostal space. Then I'm going to listen to Erb's point, which is on the left sternal border, third intercostal space. Then I'm going to listen to the tricuspid, which is on the left sternal border, fourth intercostal space. Just want to lift up your resting. And we're going to listen to the mitral, which is on the left sternal border, mid-clavicular line, fifth intercostal space. Okay, S1 and S2 were heard, S3 and S4 were not. Beats were regular. Okay. Now I'm going to get you another thing I forgot. Arm movements. I'm going to check your range of motion in your upper extremities. Just going to get you to do what I do. Okay. Patient has full range of motion in the upper body. Muscle strength is at +5, and also going to test her range of motion in her neck. Just do what I do. Okay. Patient has full range of motion in the neck. Okay. Now I'm going to get you to lay down on the bed. I'm going to inspect your abdomen. Okay. I'm going to inspect your abdomen, and I'm going to start in the right lower quadrant, and I'm going to listen for active bowel sounds. Okay, active bowel sounds were heard in all 4 quadrants. Now I'm going to palpate your abdomen. If you feel any pain, just let me know and I'll stop. Okay, patient's abdomen is soft to the touch, no lesions, no bumps, no bruises, also non-palpable. And I'm going to move down to her lower extremities. Check for swelling. Okay, no edema noted. Move the camera. Okay, now I'm going to check her pulses, her dorsalis pedis, and her posterior tibias. Okay, both are regular and +2 bilaterally. Her nails are pink and concave. Her capillary refill is less than 3 seconds bilaterally. I would also check for jugular vein distension. I would raise the bed up between 30 and 45 degrees with no pillow and check for JVD. I believe that's it. Okay, Ms. Francis, that concludes our physical assessment today. I would make sure the bed is locked and low, side rails are up, and make sure the call light is in reach for the patient. Thank you for your help today, Ms. Renfro. Now I'm going to go document my findings.